Ladies and gentlemen, Amar.
So I want to start off by thanking Plumman for having us present. This has been a great opportunity. I am also a founder at Howdy, and today I'm going to be talking to you, work a little bit further into the craziness that we call the payment model. So James touched a little bit on how rebates work and how payments flow. I'm going to get into a little bit more of the nitty-gritty because we both believe that it's disgusting and that there's plenty of middlemen that are just reaping benefits and profits off of everybody, specifically people that are paying for these medications that actually need them. So my presentation is Bitcoin adoption in healthcare payments, because we really believe that Bitcoin can solve the payment structure that exists in the US today. So a little bit about Howdy. We do provide drug rebates back to consumers. We are the only company, we believe, in the entire world that is doing this in the healthcare system. We're leveraging the potential of Bitcoin to essentially make medications free. That is a commitment that we've been working on for the last 3 years. We have been able to offset prescription costs by about 10%, and we are hoping to get to 100 sometime in the near future. We talked a lot about delayed gratification, a lot about low time preference, and we believe Bitcoin is the perfect avenue to provide that to consumers. So I'll be talking to you guys about the actual healthcare spend that goes on within the US and pretty much how fucked up the current payment model is, the fees that are associated with that, and then the opportunities that Bitcoin provides. So this is a chart that is showing how much the US spends on healthcare versus every other country in the world. The average of all the countries put together is about $6,500. US spends about double that at $12,500. It's about 17% of our total GDP, which is $4.25 trillion. And yet we have some of the worst outcomes in the world. Most people still don't have adequate access to healthcare, and a significant portion of the US either remains underinsured or completely uninsured, which is absolutely preposterous to me. A big reason for this crazy spend is, instead of taking proactive measures, we tend to focus on issues as they come at hand. So if somebody has been eating like shit for 35 years and all of a sudden they have heart problems, well, we'll take care of that then. We don't decide to do anything about it before. And so when you're spending a lot of time and money on healthcare at that very moment, you're going to end up spending more money. So administrative costs are another thing. James touched on this a little bit, but I'm going to go into the nitty-gritty of it. It makes up about 8% of the total healthcare spend. And a big reason for that is most of our insurance comes from private insurers, not the government. So more private insurances means more benefits to administer, which therefore means more administrative spend. And somebody had a question about why drugs are so expensive in the US. Well, because a lot of stuff is privatized, prices can be whatever they want it to be. So these are the administrative entities that exist in the model. We have your health insurance companies. Most of it's privatized on top of the government entities that facilitate benefits. And because these health insurance companies don't want to deal with everything themselves because it's too much work, in the 60s and 70s, a new industry came out of thin air called the pharmacy benefit managers. And they are the ones that link pharmacies together with health insurances. So middleman number one, just keep that in the back of your head. Around the late 2000s, or early 2000s, I mean, all these PBMs decided, we don't want to do all the work of what we committed to doing before in the 60s and 70s. So other intermediaries called Pharmacy Services Administrative Organizations came out to be. And they essentially take the PBMs and facilitate those between pharmacies. So now you have a middleman working for the middlemen that are then to the patients. Absolutely insane, right? So I'm a visual person. Let's visualize what this actually looks like. This is the clusterfuck that we call the US payment model. Everything that you see in yellow is common sense. So you have your patient on the right side, your drug manufacturer on the left side. Money is going left and drugs are going right. I think that makes perfect sense. The rest of this shit doesn't need to be there, but it exists. So we're going to focus on the purple part, ignore kind of the rest, but I'm going to provide some solutions as to why this is there. Major problems. So first of all, inefficiency, big thing. Let's say you go to the pharmacy, you get your medication, you pay your $5 copay or whatever your cost sharing is. I, as the pharmacy, don't get paid till 30 to 90 days later. So let's say that medication costs $25. You gave me $5. I'm still in the hole $20 for 30 to 90 days. The people that I bought the medication from, they got to get paid in 10 days. So I'm already in the hole. On top of that, that same drug that you spent $5 at my pharmacy for, if you go to James's pharmacy, it's going to cost you $10. There is absolutely no consistency. On top of that, there's no transparency in this entire model because the medication can essentially be audited a few years later, and they can say, hey, you got all this money, you got paid $25 for this drug. Well, we think we paid you too much, so we're going to take some money back. And this can be 2 to 3 years later, which establishes this entire thing of no property rights. You get paid today, 2 to 3 years later, the insurance can come back and say, hey, we paid you too much, we want some of that money back. Makes absolutely no fucking sense. With all of that interesting, crazy stuff that you saw in the model comes a fee associated with each and every organization. So every single claim that we bill to the insurance cost about 13 cents when I was still practicing. So if you bill the same insurance 3 times for that medication, it's 13 cents times 3. Administrative fees are a regular thing in the industry. It's something that I like to call a pay-to-play model. If you don't want to pay the administrative fees, then you can't play, which means you can't serve those patients, you can't fill their medications, you can't provide the services that you essentially went to school for and are passionate about doing. So pay-to-play model. Don't pay, can't play. Direct and indirect remuneration. This is the most disgusting fee model that exists, in my personal opinion, in the entire pharmacy industry. I'm going to go into a little bit more detail on the next slide. And then payment transaction fees, which are a big thing that I believe Bitcoin can solve. Bitcoin on the Lightning, very low payment transaction fees. So what are DIR fees? DIR fees were initially started in the early 2000s by the government to ensure that all drugs cost roughly the same. They wanted to make sure that the overall cost of medications was lower for patients. But the government, being lazy or didn't want to do what they intended to do in the first place, decided to put that power in the hands of those disgusting people that we call the PBMs. Well, we talked a lot about sovereignty and property rights and all these things over the course of the last 2 days. When you put control of your money into somebody else's hands, whose only goal is to make more money off of the money that you're paying them, they're going to use it to their advantage. So these DIR fees don't lower the cost of medications at all. In fact, they drive up the cost of medications, and that's why drugs cost 2 to 3 times more in the US than they do anywhere else. Because these entities decided that they're going to loop all of their administrative fees, performance adjustments, any other costs that they want to charge you, they're going to loop all that in under this nice term called DIR and give no transparency as to why this even exists. The craziest thing is that it's not done at the time of sale. So the insurance and the PBM will pay you, and then 6 to 9 months later, they're going to say, hey, we think we paid you too much, or we think that your performance for this specific patient wasn't good enough, so we want to claw back some money. You've already, as the pharmacy, deployed that capital, paid your employees, bought more medications, serviced more patients, and now you are being charged for that service that you didn't do well enough. And on top of that, it's not a bill that they send you. They just cut it from whatever they're going to pay you in the next coming week. So you don't really have a choice to do anything. And if you don't want to pay it, well then guess what? You can't play. No pay, no play. That creates a lot of financial uncertainty. Obviously, a lot of pharmacies struggle with this, and the shit gets worse year after year. That's part of the main reason why I decided to leave the practice altogether and find a better solution. And then property rights. You know, the pharmacy doesn't actually own the money that they've been paid for the service that they have already provided for 2 to 3 years, 6 to 9 months at least. But, you know, they do a blanket clause like over 2 to 3 years, like James had mentioned earlier, where they can claw back 18 months worth of claims at once. So this is what the new model looks like. As you can see, I had a little artistic moment and drew some arrows. There's a switching company, there's a payment processor, and then there's a flow of funds that also goes to these PBMs. Everything in purple, that's variable. These costs are not static, even though that they should be. This negotiated payment takes 30 to 90 days, even though you have to pay the wholesaler, the manufacturer, and everybody on a net 10-day window. So you are pretty much in the hole anywhere from 20 to 80 days. And 6 to 9 months later, or 2 to 3 years later, or whenever this little blue section called the PBM feels like it, they can take more money back from you. Crazy, right? So some of the issues recap. There's a lot of middlemen, creates a lot of inefficiencies. There's a lot of payments that don't need to be made. And overall, there's too many administrative costs, which are causing drugs to be so expensive in the US. Patients don't know what they're paying for. Pharmacies don't know what they're being charged for. And everybody is just living in this weird limbo of uncertainty. So what does Bitcoin provide? Because that's why we're here. Transparency and consistency. Immutable records are the most important thing. If I am billing for a medication or providing you a service today, and that gets recorded on the ledger today, then that should not be disputable after today. That's how it should work. It's not like, hey, I'm giving you this right now, but 2 to 3 years later, feel free to look at it again, and if you think that it wasn't good enough, go ahead and take some money back. No, that makes no fucking sense. This is how it should be. Once it's recorded today, it's recorded. The pharmacy knows, the patient knows, and the insurance knows where their money is going, how it's being spent, and all of that happens today. Pricing transparency is another big thing. If you go to the pharmacy and you buy that drug for $5, you can't go down the street and that drug shouldn't cost you $10. It should cost you the same $5 because that's how much the drug costs. If all of that is recorded live and all of that is consistent throughout, then we shouldn't have an issue. All these post-claim settlements would be gone because there is consistency in pricing. Lightning and payments are the most important thing that will get rid of a lot of this transaction fee bullshit that occurs. Payments settled via Bitcoin Lightning are done at the time of sale. Because they're done at the time of sale, there is no need for these transaction fees, or the transaction fees are very low. Because the pharmacy and the insurance is paid immediately, you don't have these intermediary payment facilitators and all these extra entities that are driving the cost of these medications up in the first place. As a result of that, drug prices can be lower, which means that the cost incurred to patients ultimately will be lower, making the cost for medications lower in the US. Efficient claim processing, again, real-time settlements, claims and costs can be verified at the point of sale. This whole system of let's figure it out a month or 3 months or a year or 3 years down the line doesn't make any sense. The final settlement of payments has to happen at the time of sale. That way there is no question about what's going on after that. I talked a lot about direct payments and payments on the Lightning Network. Bitcoin can facilitate these payments directly from the patient to the pharmacy and from the pharmacy to the insurance. Putting control of all that money in the hands of an entity whose job it is to just make more money doesn't make any sense. If we can eliminate those entities, we can eliminate a lot of these issues. Our biggest mission right now is to reduce out-of-pocket costs for patients. I've mentioned this before, but less parties involved means less administrative costs, which means cheaper medications. Right now, we are focusing on providing drug rebates back to consumers. And the only way that we have figured out to do that is by taking some of these rebates and costs and fees that do exist, providing it back to patients until we can figure out how to input a lot of this conceptual stuff into reality. Bitcoin is providing us the opportunity to give that money back to customers and consumers, and we're the first platform to do so and to provide these rebates. This disgusting thing called DIR fees, they shouldn't exist. They're bullshit in the first place. Eliminating these is pretty simple. If everything's recorded live on the ledger, if there is no issue or question as to whether there was validity or not to any of this, then there is no need to go and look at this 2 to 3 years later. Everything is recorded at the time of sale. Property rights are established. You own your money, and there's nobody else that can kind of control that. So that's a level of transparency that I think needs to be implemented in the healthcare system. Healthcare needs to be clear, like I said, in that previous model where it's back and forth. All these extra players and middlemen don't need to be there. So as you can see, Bitcoin can have an impact on a lot of different places. Right now, we are at that bottom right. We're providing some of the value that is being extracted by customers from PBMs, giving it back to our customers. But Bitcoin has implementation in pretty much everything in this graph. Ideally, we want to get rid of a lot of these middlemen and bottom parts, but this is what we're doing right now. So just to recap, what does Bitcoin do for the healthcare industry and for pharmacy payments specifically? Three main things: speed, efficiency, and transparency. So I'll leave you with that. If you guys have any questions, feel free to find me after, and feel free to check out Nihadi as well. Thank you.
Yeah, let's just keep you here, Amar, for a little while. I have some questions.
Yeah.
Actually, it's going to be the last talk after this, so I don't know if anybody at the back could go out and tell everybody that the last talk is coming up, create a little bit of FOMO and get some people in. I know, yeah, it's 6 o'clock on a Sunday, so I guess a lot of people have already left, but it'd be nice to get some more people in just for the last talk here. But you were a doctor?
Pharmacist.
Pharmacist.
Yeah.
James is a pharmacist.
Yep.
How many orange pills have you prescribed?
Quite a lot.
Well, actually, I am interested.
Yeah.
How did you find Bitcoin? And I should have asked James when he was up here, but you can feel free to join us up on the stage again, because I think it's pretty interesting. You've both flown across from America, I'm assuming.
Yep.
Thank you for coming. That's a huge effort for both of you. And so, yeah, how did Plowman find you?
Plowman found James. It's actually a funny story. I don't know if you want to.
Hang on, here we go. Okay, yeah. All right, come on, no. Let's get on the squares here. There's something to be discussed.
Yeah, Plowman, he found me on LinkedIn. He called me a scammer because he didn't really get my business model that we were doing. I was like, no, this is actually a real business model. Like what we're trying to do, we're trying to solve prescription costs with Bitcoin. So I took a meeting with him at like 1 a.m, trying to talk to him about this stuff. And then he started realizing like, oh shit, this is actually like a real business that we're trying to do. So yeah, and he's asked us to come speak at this conference. So,
where did you guys fly in from?
California.
California, dude,
yeah.
That's huge. Well done. Right, yeah, well done. Especially since he was calling you a scammer. So, where did so Bitcoin? Let's find a little origin story. There you are. You're doing your jobs. Were you friends before?
Yeah, so we actually went to pharmacy school together.
Okay.
Yeah, so I got introduced to Bitcoin in 2012, 2013. Thought it was just internet money. Didn't really know what to make of it. And then my real exposure to it was in 2017 when I guess I just started looking into it, doing more research, actually listening to my own research rather than people and just whatever they're saying. And then just slowly started accumulating and putting money in. And it's been that ever since. Sort of the entire property rights and the entire sovereignty. I realized how downhill the U.S. economy was going, and it just kind of all made more sense to me. Yeah.
Silk Road.
Yeah.
You won't find anyone else, I'll admit that publicly. But yeah, no, when Silk Road came out, when you wanted to buy weed in college, you had to use that. And definitely went on PayPal to buy Bitcoin. And I definitely had a laptop with a couple hundred Bitcoin on it. I did not understand it after college, and I threw away that laptop. Come back to graduate school, I started, learning more about Bitcoin. I'm like, oh shit.
So then, when did you start putting your heads together and thinking about, Bitcoin fixes this, right? We all know Bitcoin fixes this, but you guys are sitting there. You're probably doing your day job, running 1,000 miles an hour on the hamster wheel. Doing what you need to do, what you practiced at college, using your certification. At what point did like the orange rot creep into your brain and start, nagging, you've got to get away from this and do something in the Bitcoin space?
It's funny, we were not doing our day jobs when this idea came about.
When we first came up with this idea, we were actually pitching a lot of different C-suites and pharmacies. This was right after FTX collapsed. And I can tell you the first C-suite meeting we took, the CEO just said, get the fuck out. I don't want to ever hear about fucking Bitcoin ever again. A year later, he emails me and says, hey, my kid won't stop talking about this. Can you just come back and talk to me about Bitcoin? So that was kind of our foot in the door. And that's how we got, the first couple thousand pharmacies in our network, and then kind of just spiraled from there.
No. Anything
to add on that?
No, I mean, we first thought of the idea, I want to say almost, 3.5 years ago, 4 years ago? We've been in the industry combined for about 15 years. So year after year, we just saw how much more convoluted it got. And we were actually, I don't remember what city we were in, but we were somewhere hanging out in a hotel room, and we're like, there has to be a better solution. And we just kept talking about Bitcoin. I think at the time, Bitcoin's price was fluctuating. It was going crazy. And we're like, this could really work and solve a lot of these payment issues. What do we do? And ever since then, it's just been an idea that was in the back burner that just kind of kept coming forward and forward and forward. And then James decided, 2.5 years ago, I decided earlier this year to just peace out from the practice that we were in and go and do this full time. So
nice. And I noticed you brought up Mark Cuban, a favorite amongst Bitcoiners. I remember his Bitcoin Bananas little video, and it's nice that you made a little sideways reference there. But you're going to try and disrupt, what he's doing. I would love to see that happen. Have you? What kind of pushback have you had from those that are ingrained in this system and are milking it to death?
Look, I mean, what he's doing, it's great. It's calling attention to how bad the healthcare system is, but he's forcing independent family pharmacies to lower their drug prices, and he's taking a 15% cut of that. When I look at that, that's a terrible model. I mean, why don't you just give back all the value back to the customer and all the rebates that you're getting on the back end that you're not telling your customers about? Why don't you give it back? You keep saying that you're a billionaire and you're doing this for selfless reasons. I don't believe that. If anything, I'm probably willing to be paid a lot less because I believe the value of my Satoshis or my Bitcoin will be worth a lot more in the future. We're willing to delay gratification. That's why we became healthcare providers, and that's why we found Bitcoin to be so amazing. It really aligns with our incentives and just sort of our moral values.
Anything to add there, Amar?
No, I just think what he's doing is a grift at the end of the day.
It's an exact grift.
Yeah. And it's the simplest way to put it.
And sliding under using the classic idea of philanthropy and altruism, which is what the grifters always lean towards. Well, anyway, guys, thank you so much for coming. It's been great to get to know you a little bit. And you can ask these guys some questions outside anytime. So